A major challenge for health and social care is integrating services so that people who need support out of hospital can be supported in their homes. In Sunderland, a wide range of partners are leading the way by working together, wrapping all services around the patient. The Altogether Better programme is keeping people out of hospital and improving health outcomes.
John Talbot was recently discharged from hospital and he's now back where he wants to be, at home.
I'm 80%. Feeling good.
And it's nice to be home.
And it's nice to be home.
Where a patient like John might once have stayed in hospital, now the care comes to him from the Recovery at Home service.
They do his blood pressure and they just make sure that he's coping all right.
As well as his sister Judith checking on him, John also has the support of nurses Tanya and her colleague Claire, and regular visits from Christina from Age UK.
I'll go and put the kettle on. I'll make a cup of tea for us, all right?
Age UK is an integral part of Recovery at Home, and Christina first contacted John's GP when she suspected he was unwell.
We initially came to help John with a referral from Sunderland Royal to assist with domestic and shopping support. But when I arrived, John was displaying symptoms of being very confused. So I phoned the GP because I was really concerned that he wasn't managing his medication.
After Christina raised concern, John's GP called the Recovery at Home service, who sent Tanya and Claire to visit him. The service is committed to a rapid response, and John was seen within the hour.
We came in, assessed him, examined him, ruled out any source of infection, provided a holistic assessment to make sure that John didn't have any social needs and was able to manage at home. We did actually refer to social services for emergency assessment for a care package and referred to the GP for medication review.
The call from John's GP came here. An assessment was made and the appropriate care dispatched. If a hospital admission isn't necessary, the team here sends the right medical or holistic services to see the patient at home.
This hub now means that by dialing just one number and telling your story just once, a patient can access help from nurses, GPs, therapists, pharmacists, social care staff, all manner of support, all working together.
Hello, baby.
If needed, Recovery at Home also has 2 community bed units, one of which is this, the Intermediate Care Assessment and Rehabilitation Unit, or ICAR.
Well, we're quite a unique service here at ICAR. We don't just provide nursing and medical support for patients, we also provide emotional care and also trying to get people back to their previous independent state. They need quite a lot of emotional support and coaching, really, and I think that's quite confidence building with a lot of the patients is quite important, especially elderly people when they've had falls and they're not sure whether they're going to be able to manage again in their own home environment.
Once someone is discharged from a community bed, the team here ensures the correct support is in place for the patient before they return home, working hand in hand with a GP like Val Taylor.
The GP's role is key because they have got the patients on their lists, they know them, and instead of being more reactive in the way they work, where you get somebody phoning in for a house visit or coming into the surgery, we're actually working with the rest of our community teams to try and prevent problems and crises occurring.
There you go, John. There's a cup of coffee for you.
And this is exactly the kind of community care John is receiving. In place of hospital admission, he has 24-hour on-call support at home, which for many patients is where they'd much rather be.